So yes, hello everyone. So here we are going to start the Grand FMGE December session Anatomy Quiz Part 3. So let's start with the session now. So I think most of the students must have joined, and let's start with it. So already covered up the already I have covered up the FMG Grand MCQ session Part 2 just now. Now this is the Part 3. Okay. So my dear aspirants, myself Dr. Monalisa, I have done my MD Anatomy from Armed Force Medical College Pune, and I am here as an educator of anatomy subject on the Plus platform of Unacademy. So this is my code, that is ANAT10, which can be used by you if you want to be the part of free sessions on the Unacademy platform, or you want to be the taking the subscription of Unacademy. Then in that case also you can get 10% discount. Now my dear aspirants, I also want to tell that do present for the free sessions on the Unacademy platform. So on the Saturday evening and on Sunday morning. So I am going to plan the sessions, Saturday evening sessions I am planning, and Sunday morning sessions I am planning. So all those who are interested can join me for these sessions. This will be highly beneficial. Good evening Sri, good evening dear. So Saturday evening, Sunday morning sessions, which is planned for the free live sessions on the Unacademy platform. So that will be targeted for clinical anatomy MCQs and also the cadaveric image based session, and clinical anatomy MCQ session, especially on the platform of free platform of Unacademy. So do join by using the code ANAT10 unlock and be present for the free session Saturday evening and Sunday morning. All the links will be provided in the group. Don't worry, all the links will be provided in the group, Telegram group. Now what are the features of free sessions? So when I am talking about the free sessions of Unacademy platform, I do just want to brief you the platform free sessions benefits. Attend a live session, be present for the live session and live charts, and get your doubts clear live during the sessions. A response to poll for a better understanding of a topic, and talk to your educators live class and get your doubts cleared. Get notified for the sessions, upcoming posts and recommended for you. Lecture notes along with PDF notes will be provided to you. Attend the live classes, participate in live chats, and get your doubts cleared right itself. Also the benefits of special free classes that you will get, you can download the PDF notes. Now what are the benefits of Plus subscription? When we are talking about the Plus subscription, the benefits are too many benefits are there. Actually all 19 subjects will be covered in a very systematic way. So all 19 subjects will be covered up, live and the recorded versions. Study from India's top educators, compete in live tests and quizzes, study from the device of your choice, assess more than 25,000 clinical MCQs of all 19 subjects. The explanation for each and every MCQs is provided by the top educators of Unacademy platform, and soon is, if you take 1 year of subscription and more, you will get printed notes of the Unacademy. So all these benefits are targeting you towards your goal. So go for it, use my code ANAT10 and get 10% discount. I also want to tell you about the iconic subscription. So when we are talking about iconic subscription, again you can get the benefits of both the Plus platform and that of the Prep ladder. So both the platform is added on benefits, clinical integrated essentials, video lectures from the dream team, QBank 3, rapid revision and snapshots, treasure dream notes of 2021. All these will be provided to you, iconic subscription. So here the benefits of both the Plus platform and the iconic subscription is provided to you. So just go for it and take the subscription. Use my code ANAT10 to get 10% discount. I also want to tell you about getting your doubts clear during the session and the comparison of NEET PG subscription and that of iconic subscription. So whether you are going for 1.5 years, 2 years or 3 years or 4 years, you can have a demo live sessions on the special platform. You can go for the Plus subscription. The benefits of both Plus and iconic has been compared, and what I tell that if you are going for the next examination, NEET PG, INICT, FMG examination, just grab the opportunity of taking the iconic subscription, because you are getting the benefits of two platforms. One is the Plus platform of Unacademy and another is the Prep ladder. So use my code ANAT10 and get 10% discount. So use this code and get additional 10% discount. Now I also want you to tell about the highly effective QBank of the Unacademy, which is highly effective, made by the top educators of Unacademy platform. So more than 25,000 clinical MCQs are there based on the latest pattern of examination, includes a detailed description of each and every MCQs. Boost your preparation by taking 2 years of subscription and that of 12 month, and you get an additional month of subscription free. Use this code NAC10. Also, I want to give you the information regarding free test on the Unacademy platforms. Free tests are there. That is, the free test is one on the 24th October Sunday, another on the 31st October, that is Sunday. So this is for FMG examination, and 24th October is for INICT examination. The timing is there. INICT 2 to 5 and that of FMG examination free test is 10 AM to 1 PM on 31st October. So just get enrolled by using the code NAC10 for this test, free test. Also, I want you to tell about the 23rd October, that is Saturday, 2 to 4 PM, there is 120 MCQs. This is targeting for the NEET PG 22 aspirants. So this is another free test. Get enrolled by using the code NAC10. Raise your hand, ask your doubts in the live sessions of Unacademy platform. I want to congratulate the toppers of NEET PG. So I just want to congratulate the toppers of NEET PG aspirants 2021 September session. I am very glad to share their images with you. So all the best to them for their future tenures. Now let's start with the MCQ session. So let's start with the first MCQ of today's session. All the best to everyone. So all of you, I will give you 30 seconds to mark the correct answer. Where does the circle of Willis is lying and located? Whether it is subarachnoid space, subdural space, intraventricular spaces, or none of the above. So all those who have joined, they can give me the answer in the poll. Okay, they can give me the answers in the poll. So your time starts now. For every MCQs, 30 seconds will be provided to you. 15 to 30 seconds. Circle of Willis is located where? In the subarachnoid space. Ashish Pandey has given the answer A. What about others? Where does circle of Willis is located? So I have got an answer from Ashish Pandey. Okay. So actually, yeah, A is absolutely correct answer. Actually, circle of Willis is it's located in the base. It's important to know the location. So the location is it lies in the inferior surface of the brain. It is located in the inferior surface of brain, in the interpeduncular region, in the interpeduncular cistern. The location is in the interpeduncular cistern. The location is in the interpeduncular cistern, and actually it is located in the subarachnoid space. So this actually interpeduncular cistern is the subarachnoid space which is enlarged. What do you mean by the word interpeduncular cistern? So actually interpeduncular cistern means the enlarged subarachnoid space. So wherever the subarachnoid space is enlarged, subarachnoid space is enlarged and containing a more amount of CSF, that is cerebrospinal fluid, that is called as subarachnoid cistern. So it is located in one of the type of subarachnoid cistern, that is interpeduncular cistern. I would like to show you this diagram. Let me slightly highlight it. So all of you just concentrate on this area. What is this? This is the circle of Willis. What I have encircled is the circle of Willis. You can see here actually this is important for you to know. Here you can see this is the basilar artery which is giving the branches. So this artery is BA for basilar artery, and this is exactly the location of circle of Willis, which is located in the base of the brain, inferior aspect in the interpeduncular cistern. Okay. So this is exactly, so actually we can also discuss how it is formed and all. So we will have another MCQs regarding to this topic also, don't worry. So now we are only concentrated on the location of the circle of Willis. Actually this is an anastomotic network which is seen in the base of the brain, which is formed by the posterior cerebral arteries, the posterior communicating artery, anterior cerebral, internal carotid artery, and communicating arteries located in the subarachnoid cistern. Let's move on to the next MCQ, that is MCQ number 2. Okay. So after removal of parotid gland, the patient is having sweating on the cheeks. The patient is complaining of sweating on the cheeks while eating. in this complication seen, so in this complication which is seen after doing the parotidectomy, the auriculotemporal nerve, which contains parasympathetic secretomotor fibers to parotid gland, is fused with which nerve? It is fused with which nerve, whether it is glossopharyngeal nerve, facial nerve, great auricular nerve or buccal nerve? Question number 2, mark the correct answer. Okay, so you have got, so all of you just write the answer. So you will write question number 2 and you will give me the answer. So 15 MCQ series is there. So I got an answer from Ashish Pandey and I got an answer from Sri Rangraj also. All others, so it doesn't matter whether it is right and wrong. What matters is it's your contribution. Okay. So yes, mixed bundle of answers are coming up, A, B, C and B. Okay, mixed bundle of answers are coming up. Actually, we know that it's a condition of Frey syndrome in which auriculotemporal nerve, which is an important innervation of the parotid gland, secretomotor fibers are passing through the auriculotemporal nerves, and also it is actually injured at times of surgery done in this area. So what happens when the nerve is regenerating, it will grow along with the fibers of great auricular nerve. So great auricular nerve, C is the correct answer, which is providing innervation to the skin around the area of the parotid region. So it is for the sensation. So actually let me just elaborate the whole description. So when we are talking about the Frey syndrome, so Frey, जब हम Frey syndrome की बात कर रहे हैं, okay, so Frey syndrome is also called as, please note down, it is also called as Ballinger syndrome, Dupuis syndrome, auriculotemporal syndrome and Frey-Ballinger syndrome. Ballinger syndrome. So actually all these names, why I am telling you this name, auriculotemporal syndrome, Frey syndrome, Ballinger syndrome, Dupuis syndrome, all these are the names of the same syndrome. So sometimes what happens, yeah, absolutely right Ashish Pandey, you are absolutely right Ashish Pandey. So actually these are all the names of the similar condition. It's a neurological disorder where there can be a damage to parotid gland, and it as we know, the parotid gland is very much responsible for the secretomotor fibers traversing, and much of the saliva is formed from the parotid gland secretion. Auriculotemporal nerve at times get injured, and what happens when the regeneration is occurring, adjacent auriculotemporal nerve will grow along with the fibers of great auricular nerve, and when the person is saving or at the sight of food, the sweet sour food, the whole of the inflammation will be seen in the parotid region, redness, swellings and also sweatings will be seen. So this appears when the person, affected person eats or dreams or talk about the food. So strong salivation is produced along with the skin around the parotid region is red hot, and it will lead to, at cases, it can also lead to focal hyperhidrosis. So these are the symptoms which is seen. Yes, Ashish, this is a condition of Frey syndrome. So my dear aspirants, I would like to show you this diagram where you are more clear with this. What you can see, this is the region of parotid region. What you can see, general afferent sensory sensations. Can you see it is given with the great auricular nerve. General afferent sensations are given by the great auricular nerve as seen in the diagram. Great auricular nerve is traversing, and we know that we already know that in case of parotid gland, the major important nerve which is supplying is auriculotemporal nerve. So auriculotemporal nerve, great auricular nerve are the reason for Frey syndrome. So in this condition, you can, this is a patient of Frey syndrome, and here you can see red hot area and very much distension, as you can see in the region of parotid area. Because of this, afferent sensations are given by great auricular nerve, and auriculotemporal nerve is regenerating along with the fibers of great auricular nerve. Now coming to the third MCQ. Among the following, which of the following passes through foramen magnum? Question number 3. Among the following, which structures passes through the foramen magnum? among the following which passes through foramen magnum. So among the following, all of the following passes except, please have a look on this MCQ nicely. So I just want to ask that all of the following passes through the foramen magnum except, question number 3, all of the following is passing through foramen magnum except. So my question is except. Now all of you please note down, I am asking except. So all of you, okay, so please read the question nicely. I have written the word except. All of the following, sympathetic plexus, it is sympathetic chain plexus it is, okay. So you just tell me which of the following structure is not passing. My question is not passing. Which structure is not passing through foramen magnum? Okay, it's 12th one. Okay, so yeah, so leave it. So the question is similar only, it's 12th, so it is okay. Now you can give me the answer. Among the following which passes through foramen magnum, not except. So all of you please see here, so I thought it is 11th cranial nerve, so I got confused, it's 12th one, so the question is right. So you just tell me which structure is passing through the foramen magnum. Question number 3, which structure is passing? So all of you, my dear Monica, Nidhi, Shri, Ashish, everyone, which structure is passing? So it's not passing is not the correct, I am just asking passing. I thought that C option is 11th cranial nerve, so I got confused, it is 12th only. So just tell me which structure is passing. Which structure is passing? Which structure is passing through foramen magnum? Now, yes, I am so sorry for it. So please make a correction. Now yes, now your answer is absolutely right. It's the vertebral artery. Yes, vertebral artery. It's the vertebral artery. Yes, yes, absolutely right. So A is the correct answer. So internal carotid artery is not the correct answer. Why? Because it is passing through carotid canal. 12th cranial nerve, hypoglossal nerve. Sympathetic plexus around vertebral artery passes, but not the sympathetic chain. Sympathetic plexus around the vertebral artery will pass through foramen magnum, but not the entire sympathetic chain. So yes, it's a vertebral artery is absolutely correct. So A option is absolutely correct. So all of you are perfectly right. Now let me show you a diagram here. This is the foramen magnum. So I am just so as you can see here, I am just using this what is this? This is actually alar ligament. So actually alar ligament is dividing the foramen magnum into A and P. What do you mean by A and P? Okay, so here we can see foramen magnum. Here we can see the foramen magnum, and what you can see, this is the outline of foramen magnum which is shown, and it is divided into two compartments A and B by the attachment of alar ligament. What is important for you to know is the structure passing through the anterior part of the foramen magnum and posterior part of the foramen magnum. Now, I would like to share this another diagram where you can clearly see the structures passing through the anterior and the posterior part of foramen magnum. See here, so actually this is the A part, this is the anterior compartment, A for anterior compartment, and this whole is the posterior compartment. Actually through the anterior part of foramen magnum only the ligaments are passing, so it is called as osteoligamentous compartment. So anterior part is called as osteoligamentous compartment of foramen magnum. So through osteoligamentous part of foramen magnum, the structures passing is apical ligament of Dens, cruciate ligament superior band, and membrana tectoria, and that of membrana tectoria. So this is 1, this is 2, and this is 3. 3 structures passes through the anterior part. 3 structures is passing through the anterior part. So this whole structure is the anterior part, and this anterior part से सिर्फ ligaments pass कर रहे हैं, इसलिए इसको क्या बोलते हैं? Osteoligamentous compartment बोलते हैं. अगर आप posterior compartment देखेंगे तो posterior compartment is having neurovascular structures passing. So this is the hole which I am shading with the light green color. This is hole, the posterior compartment of foramen magnum, and from the posterior compartment of foramen magnum, neurovascular structures, means nerves and the vessels are passing. So it is called as neurovascular compartment. So posterior compartment is called as the neurovascular compartment. It is called as neurovascular compartment. Neurovascular compartment. The structures traversing is anterior spinal artery, vertebral artery, spinal root of accessory nerve, also tonsil of cerebellum, lower part of medulla oblongata. So all these structures which is shown here, the spinal arteries, vertebral arteries, spinal root of accessory nerve, tonsils of cerebellum, lower part of the medulla oblongata, all these structures are passing through the posterior part of foramen magnum. Absolutely right, all of you. Let's move on to question number 4. Okay. The apex of plantar aponeurosis is attached to, which of the following? The apex of plantar aponeurosis is attached to which of the following? Whether it is tuberosity of calcaneus, whether it is medial tubercle of calcaneum, whether it is lateral tubercle of calcaneus, and whether it is medial or lateral tubercles. According to you, which is the best answer? Question number 4, mark the correct answer. Apex of plantar aponeurosis is attached to which of the following? Tuberosity of calcaneus, medial tubercle of calcaneum, lateral tubercle of calcaneum, medial and lateral tubercles. Which is the correct answer? Question number 4. Your time begins now. So, you just give me the answer by writing 4 and give the answer. Okay, so I am getting answers, and Nidhi Chauhan has given, Nidhi Chikani has given B, Monica Sri Langraj B. Okay, so I am getting more of B as the correct answer, that is medial tubercle of the calcaneum. Medial tubercle of the calcaneum. So yes, apex of plantar aponeurosis is attached to medial tubercle of the calcaneum, and that is perfectly the right answer. Yes, that is perfectly the right answer, that is plantar aponeurosis. So actually plantar aponeurosis is protecting the nerves and the vessels, digital nerves and vessels which is lying in the sole. And if we talk about its attachment of the apical aspect, it is extending from the medial tubercle of calcaneum and then going towards the toes. So plantar fascia, if you talk about plantar fascia, it's a modification of deep fascia. What is it? It's a modification of deep fascia. And this is a thick connective tissue aponeurosis which is supporting the bottom or plantar side of the foot. It runs, it is running from, if we talk about its extent, it is extending from the tuberosity of the calcaneum bone. It is extending from the tuberosity of calcaneum bone, and then it extends towards the calcaneum bone, and thereafter it will head towards the metatarsal bone. Okay, so it is heading towards the metatarsal bone and it is attaching to the toes and the bones of the midfoot. See here, you can clearly see this is the calcaneum bone, and the apical part of, you can see here the apical part of plantar aponeurosis is attached to the calcaneum bone. The apical part is attached to the calcaneum bone. And thereafter it is running towards the metatarsal bones, the bones, head of the metatarsal bones and the midfoot. So it is heading towards the metatarsal bones. Now let's move on to the next, that is question number 5. All of the following muscles are hybrid muscle except, question number 5, all of the following muscle is hybrid muscle except, all of the following muscles are hybrid muscle except pectineus, adductor magnus, pectoralis major of the upper limb and quadratus femoris. So which is the correct answer? Question number 5, mark the correct answer. All of the following muscles are hybrid muscle except. So you will write your answer by writing 5 and then give me the correct answer. So, goal to aims is telling it's D. Shri is also telling D. Mixed bundle of answers are coming up. Okay, great. So, quadratus femoris is perfectly right answer. Quadratus femoris. Actually, what is the nerve supply of quadratus femoris? Its nerve supply is nerve to quadratus femoris, that is L4, L5, S1 is the root value. So, I would like rest all is the hybrid muscle. What do you mean by hybrid muscle? Composite muscle having dual nerve supply, dual nerve supply. So, these are the options which is provided. Now, let me talk about pectineus muscle. Pectineus muscle is getting innervation from two nerves, and what is this nerve? It is getting innervation from the trunk of femoral nerve, and also it is getting innervation from obturator nerve. Adductor magnus is again getting in adductor part from the obturator nerve, and the hamstring part from the tibial component of sciatic nerve. Tibial component of sciatic nerve. The pectoralis major muscle again is getting two dual nerve supply, and the innervation is, it's by the medial pectoral nerve, branch from the medial cord of medial pectoral nerve, which is a branch from medial cord of brachial plexus, and lateral pectoral nerve, which is a branch from the lateral cord of brachial plexus. Lateral cord of brachial plexus. Now, when we are talking about quadratus femoris, this is the right answer. And why it is the right answer? Because it is getting innervation from just a single nerve, that is nerve to quadratus femoris. Nerve to quadratus femoris. The root value of nerve to quadratus femoris is L4, L5 and S1. So, this is not an example of the muscle having dual nerve supply. So, we get the correct answer as D. Now, let us move on to question number, next question. So, let us move on to question number 6. Fascia around nerve bundle of brachial plexus is derived from. So, fascia around nerve bundles of brachial plexus is derived from which of the following fascia, whether it is prevertebral, deep cervical, clavipectoral or pectoral fascia. Fascia around nerve bundles of brachial plexus is derived from. Okay, so yes, 6B. Okay. Okay, so actually what happens, okay, mixed bundle of answers are coming up. Actually, there is a continuation of fascia, that is prevertebral layer. Okay, actually the correct answer is A. There is a continuation of the deep cervical fascia ka extent hai. Deep cervical fascia has got a modification of fascias. It is having investing layer of deep cervical fascia. It is having pretracheal and prevertebral layer of deep cervical fascia. So, if we talk about one of its extension, that is prevertebral layer of deep cervical fascia, it is extending through the axilla, forming axillary sheath, which is also axillary fascia, which is also forming a sheath around the cords of brachial plexus. So, A is the correct answer. So, I just want to show you this diagram. See here. Here what you can see, if it is very clear, so you can see here we have got axillary artery. So, here you can see this is the axillary artery, this structure is the axillary artery, and what are these? These structures which you are seeing are the cords of brachial plexus. See here, these are the cords of brachial plexus. So, you can see here these are the cords of brachial plexus which you are seeing. Okay. So these are cords of brachial. So here in this diagram you can clearly see the cords of brachial plexus and the axillary artery is having a covering, and this covering is called as axillary sheath. This covering is called as axillary sheath. So continuation of prevertebral layer. So let me just use green color for this axillary sheath. So this whole sheath which you are seeing here is the axillary sheath, and you can see here this is the continuation of which sheath? This is the continuation of prevertebral layer. So here you can see here the prevertebral fascia of the neck region, when continues in the axillary region, it forms, it is changing its name to axillary sheath. So this is the prevertebral layer which is continuing here to form the axillary sheath. Prevertebral layer of fascia, which is a part of deep cervical fascia, is continuing to form the axillary sheath. So everyone has got the correct answer. So axillary sheath is formed from prevertebral layer only. Got it everyone? Let's move on to the next. Rasmussen aneurysm involves. Rasmussen aneurysm involves which of the following artery? Bronchial, pulmonary artery, intercostal artery or aorta? Question number 7th. Okay dear, Rasmussen aneurysm involves which of the following artery? Bronchial, pulmonary, intercostal or aorta? So yes, I am getting mixed bundle of answers, and the correct answer is absolutely right. B is the correct answer, Arun. Yes, Arun is absolutely right. B is the correct answer. Actually, Rasmussen aneurysm, that is dilatation of the pulmonary artery, which is seen in the cases of tuberculosis patient. So it is commonly seen in the tuberculosis patient where there is caseous necrosis. They involve the pulmonary artery, and at times there can be bleeding. There can be rupture of this aneurysm, Rasmussen aneurysm of pulmonary artery, and there can be bleeding from this rupture. So it's a direct question. The involvement is of pulmonary artery. Okay dear. Now let's move on to question number 8. Covering of spermatic cord is all except. Covering of spermatic cord is all except. Covering of spermatic cord is all except internal spermatic fascia, Darto's muscle, cremaster fascia or external spermatic fascia. Covering of spermatic cord is all except. So according to you, which is the best answer? A, B, C and D. Which of the following structure is not forming any kind of covering for the spermatic cord? Question number 8, mark the correct answer. Okay, mixed bundle of answers are coming up. Actually, Darto's muscle is the correct answer. We know that Darto's muscle is not forming any covering. Actually, it's a modification of it's a muscle which is located in superficial fascia. So it is an example of panniculus carnosus muscle. It's an example of panniculus carnosus muscle. It's not an covering. It's an example of panniculus carnosus muscle. So muscles which is lying in superficial fascia is called as panniculus carnosus, and the fat which is located in superficial fascia is called as panniculus adiposus. Yes, anyone wants to write the example of panniculus carnosus muscle, few examples of panniculus carnosus muscle? They can write in the message box the examples of panniculus carnosus muscle, the muscle located in the superficial fascia. One is the Darto's muscle which is written here, other are muscles of facial expression, platysma, palmaris brevis muscle of upper limb, the cutis ani muscle surrounding the anal sphincter. So now I would like to show you this diagram where I just want to show you the layers. Actually, the layers of abdominal wall is continuing in the spermatic region to form fascias. So what you can appreciate here, two rings are also shown. So here it is showing the deep inguinal ring and this is the superficial inguinal ring. We know that superficial inguinal ring is an opening in EO, external oblique aponeurosis. Deep inguinal ring is an opening in transversalis fascia. Now what you can see that from inside to outside we have got following layers. We have got internal spermatic fascia, we have got cremaster muscle and we have got the external spermatic fascia. So here if you will see the internal spermatic fascia, which is a continuation from fascia transversalis. Internal spermatic fascia is formed from fascia transversalis FT, cremaster muscle from the aponeurosis of internal oblique muscle, and external oblique muscle aponeurosis EO is forming external spermatic fascia. Okay. So these are the layers. These are the layers which is extending from the abdominal wall and getting continued into the scrotum and that of the inguinal region and forming the layers of spermatic cord. So from inside to outside we have got internal spermatic fascia, we have got cremaster fascia and external spermatic fascia. Dartos muscle is lying more superficially. So you just see here, I would use a, this is the dartos. So we are talking about this one. This is the dartos muscle which is lying superficial to it. Actually this dartos muscle is the muscle which is lying in the superficial fascia, dartos muscle. Now let's move on to the next, that is question number 9. Nerve supply of perineum is, nerve supply to the perineum is by pudendal nerve, inferior rectal nerve, pelvic splanchnic nerve or hypogastric plexus. Question number 9, which is the best answer. Nerve supply to the perineum is done by pudendal nerve, inferior rectal nerve, pelvic splanchnic nerves or hypogastric plexus of nerves. So which is the best answer for question number 9? Your time starts now. Okay, Sri is telling it's A. What about others? Actually, pudendal nerve is absolutely right answer. Yes, pudendal nerve is absolutely right answer. Yes, pudendal nerve is considered to be the nerve of perineum and its root value is S2, S3 and S4 and it is traversing through the pudendal canal or Alcock's canal. Let me show you. So here you can see the pudendal nerve which is traversing through the lesser sciatic foramen. It is passing through, as you can see here, it is passing through the lesser sciatic foramen and thereafter it is traversing in this canal. What is this canal? What is this canal? So this canal is Alcock's canal or pudendal canal, which is formed by the separation of which fascia? Obturator fascia. So it is formed by the separation of obturator fascia. It is residing in the Alcock's or pudendal canals where they give different branches, that is the deep perineal nerve. It is giving deep perineal nerve, superficial perineal nerve, dorsal nerve of penis. All these are the branches which is giving innervation to perineal structure. These are all originating are the branches of the pudendal nerve. Root value is S2, S3 and S4. S2, S3 and S4. Now coming to question number 10. First extensor compartment of the wrist contains the tendon of which muscle? first extensor compartment of the wrist contains the tendon of which muscle? ECRL, ECRB, EPL or EPB? That means extensor carpi radialis longus, extensor carpi radialis brevis, extensor pollicis longus or extensor pollicis brevis. According to you, which is the best answer for question number 10? First extensor compartment of wrist contains tendon of. Question number 10, mark the correct answer. So, Shri has given the answer. What about others? Actually, extensor compartment and the tendons passing. Actually, extensor compartment is again lying below the extensor retiniculum, and it is important that this extensor retiniculum is holding the extensor tendons together when they are passing in the hand, dorsum of the hand. So, it is important to know that we have got 6 extensor compartments. How many? We have got 6 extensor compartment, and it is important for you to know each of this extensor compartment containing the tendons of which muscle. So, here the correct answer is D, that is extensor pollicis brevis. Yes, so extensor pollicis brevis and abductor pollicis longus, absolutely right. Abductor pollicis longus plus extensor pollicis brevis are the 2 extensor compartment which is passing through the first extensor compartment. Extensor carpi radialis longus and brevis from the second, extensor pollicis longus from the third compartment, and extensor pollicis brevis from the first extensor compartment. Let me show you the image for this. So, this is the diagram where you can clearly appreciate the extensor compartments. As we know that extensor compartment is formed by the extensor retiniculum which is attaching to the dorsum aspect. So, this is the extensor retiniculum which is shown in the green color. And from here septas are given, which is whole dividing, the 5 septas are there, so that there is formation of 6 compartments. So, it is important that the structures passing from each compartment. So, we will see the structures starting from the first compartment is 2 tendons, extensor pollicis brevis and abductor pollicis longus. So, the second compartment is extensor carpi radialis longus and brevis, third is EPL. Fourth compartment is extensor digitorum and extensor indicis. It is extensor digitorum and extensor indicis. So, it is extensor digitorum muscle and that of extensor indicis. Now, my dear aspirants, can you tell me actually fourth compartment se 4 structures jata hai. 2 is already written. Yes, VV associate, absolutely right. So, 2 is already written. Can you tell me from the fourth compartment 2 more structures passes? What are this? What are that? From the fourth compartment. So, here fifth compartment is also seen extensor digiti minimi, and sixth is extensor carpi ulnaris. Extensor carpi ulnaris and extensor digiti minimi. Can you tell me which 2 structure more passes through the fourth compartment? Sri is absolutely right. Yes, absolutely right, Sri. Yeah. So, one is anterior introosseous artery. Yes, absolutely right. One is anterior introosseous artery. What is the other one? Pin. Yes, posterior introosseous nerve. Absolutely right, Sri. So, the 2 other structures passing is anterior introosseous artery and the posterior introosseous nerve through the fourth compartment, posterior introosseous nerve. So, this diagram is very helpful for you to revise the structures passing through each individual 6 compartment. Yes, absolutely right everyone. Let us move on to the next, that is question number 11th. So, still we have got 5 more MCQs to solve. Yes, absolutely right, VV associate and Shri. So, all the best for the question number 11. All are the branches of lumbar plexus except, all of the following which is mentioned here are the branches of lumbar plexus except. iliohypogastric nerve, ilioinguinal nerve, obturator nerve, subcostal nerve. 4 options are there. All are the branches of lumbar plexus except we have got 4 options. You have to give me the correct answer. Which is not a branch? Which of the following is not a branch from lumbar plexus? Okay, answers are coming up. So we have got subcostal nerve. Okay, D. So yes, what is the root value of subcostal nerve? What is the root value of subcostal nerve? Root value. Can anybody tell me root value of subcostal nerve? Root value of subcostal nerve. So yes, Nidhi, you are also right. Nidhi. So can you tell me the root value of subcostal nerve? It's T12. It's T12. Actually, lumbar plexus is formed by, when we are talking about lumbar plexus, so this lumbar plexus is formed by L1, L2, L3 and L4. Okay. See here. So this diagram is showing you lumbar plexus and we clearly know, yes, absolutely right, T12. We clearly know it is taking contribution from L1, L2, L3 and L4 basically, but it can have a communicating branch from the 12th thoracic nerve or subcostal also, but all of the 12th thoracic nerve is not contributing. So it can have a contribution. So please don't get confused. Let me tell you, it can take contribution from the 12th thoracic nerve, that is subcostal nerve. So lumbar plexus is the web of nerve plexus which is formed in the lumbar region. It is formed by the division of L1, L2, L3 and L4. So it is formed by the division of L1, L2, L3 and L4. It can take contribution. It can take contribution from that of subcostal nerve but not the entire of T12 nerve. So we have to choose one as the best answer. It can't take the contribution from the entire T12 nerve. It can take a communication from T12 nerve or subcostal nerve. So here the best answer will be subcostal nerve is not contributing to the formation of lumbar plexus. Thereafter, let's move on to question number 12. Arch of aorta develops from which of the following arch artery? Arch of aorta develops from which of the following arch artery? Whether it is right first, right third, left fourth or left third. Question number 12. Arch of aorta develops from which of the following aortic arch artery? Right first, right third, left fourth or left third. Mark the right answer, dear. Your time starts now. Question number 12. Arch of aorta develops from, left to fourth aortic arch artery is absolutely right. Arch of aorta is taking contribution from left to fourth aortic arch artery. I want to share a Langman's table where you can see the source of development of the important arteries. So aortic arch artery. So see here, this table is very important and do revise this. So it is showing you the derivatives of aortic arch arteries. So from the first artery, maxillary artery arises. From the second aortic arch artery, hyoidal and stapedial artery arises. And from the third is the common carotid and the first part of internal carotid artery. From the left side fourth, this was asked in the MCQ, and from the left side fourth aortic arch artery, the structures of the artery arising is left common arteries and the arch of aorta, from the left common artery to left subclavian. Right side में right subclavian artery from the fourth aortic arch artery. Sixth में right and the left side different. Left side में left pulmonary and ductus arteriosus, and right side में right pulmonary artery. All of you do revise. So it is important that you should revise all the derivatives of aortic arch artery, which is very important for you to revise. because this is commonly asked in the MCQ session. Okay, VV associate. So yes, all of you are done with this. So we have got C as the correct answer for question number 12. Let's move on to the next question number 13. Lamina peperacea is lying between. Lamina peperacea is lying between optic nerve and orbit, maxillary sinus and orbit, ethmoid sinus and orbit, cranial cavity and orbit. Which is the best answer? Lamina peperacea is lying between optic nerve and orbit, maxillary sinus and orbit, ethmoidal sinus and orbit, or cranial cavity and orbit. Yes, Aman Singh. So yes, okay. So Aman Singh is asking me, respected ma'am, I am a UG student and I am planning to pursue MBBS from Bangladesh. Is Bangladesh good according to your experience? So the most important thing is that you can go for foreign medical colleges. Okay, there are so many colleges. Bangladesh is there. Also there is Philippines. So Philippines is there, then there is so many colleges in the Russia. So yes, Bangladesh is also a good option, but Aman Singh, you can also go for Philippines. Philippines would be better than Bangladesh, I think. Both are good. So if you can take a good college in Philippines also, because I have seen that the result of foreign medical colleges में Philippines के colleges हैं, उनके result बहुत अच्छे होते हैं. So you can opt for that. Always try to get foreign medical good colleges. Okay, so just see the ranking or the exam pattern, whether it is government or private, and then go for it. Okay, Aman Singh. So you can also discuss with me when you can get connected to me via Telegram. You can get connected and you can ask your doubts in the messages also. Okay, dear. Lamina peperacea is between optic nerve and orbit, maxillary sinus. Okay, I got an answer. So 13 ka C. C is absolutely right answer. Yes, absolutely right answer. Ethmoidal sinus and orbit. Actually, lamina peperacea is paper like thin. So is it okay, Aman? Aman, is it okay? So it's a paper thin bone piece, which is it's a paper thin, very delicate paper like bone, which is exactly located between ethmoidal air sinus and the orbit. I would like to discuss show you a axial CT scan image which will show you the location of lamina peperacea. So yes, so see here, this is the lamina peperacea which is shown, and this lamina peperacea is like this. I am using green color to highlight the lamina peperacea, and here you can observe clearly that this is the orbit, this is orbit, and these are small sinuses which you are seeing are the ethmoidal air sinuses. What is this? These are all ethmoidal air sinuses. So exactly in between the ethmoidal air sinuses, you can very clearly see the exact location of lamina peperacea is in between. Exact location is, it is residing between the orbit and that of ethmoidal air sinus. Ethmoid air sinus. So this is exactly the right location of lamina peperacea, and it is common injured in case of any kind of injury. Okay. Okay, dear. Okay, got it, dear. Okay, you can also ask me directly you can search me and you can ask me your doubts to be cleared. So you can directly message me also. So you can just Dr.Monalisa, you can search and you can ask your doubts also in the Telegram group, also in the Let's Crack NEET PG Telegram group and there. Okay, so let's move on to the next. Parasympathetic secretomotor fibers to parotid gland traverses through following except? Parasympathetic secretomotor fiber to the parotid gland traverses through the following except otic ganglion, tympanic plexus, greater petrosal nerve, auriculotemporal nerve. So, we have got 4 options and you have to mark the correct answer. Parasympathetic secretomotor fibers to parotid traverses through following except. So, which of the following is not involved? Okay. So, the question is asking which of the following structure is not involved in the parasympathetic innervation of parotid gland. Okay, mixed bundle of answers are coming up. So, I think I will show you the flow chart also. Yes, absolutely right. VV acetate, VV associate, greater नहीं, यहाँ पे कुछ और. So actually the correct answer is greater petrosal nerve. Here lesser petrosal nerve is involved, not the greater petrosal nerve. The lesser petrosal nerve is involved. Otic ganglion is the ganglion for the parasympathetic secretomotor fibers to parotid gland. Tympanic plexus from glossopharyngeal nerve is traversing, so that is also not the correct answer. Lesser petrosal nerve should have been mentioned, but here greater petrosal nerve is mentioned and auriculotemporal nerve is there, we know that. So, absolutely right. In case of parotid gland, we have got 9th cranial nerve involved, not the 7th cranial nerve. So, see this flow chart and you will better understand this. See here. Okay. So, what you can see from the inferior salivatory nucleus. So, from the inferior salivatory nucleus, what you can see that inferior salivatory nucleus is the nucleus for the origin of preganglionic fibers. So, preganglionic parasympathetic fibers is arising from inferior salivatory nucleus. Preganglionic parasympathetic fibers are arising from inferior salivatory nucleus, and from here they traverses through glossopharyngeal nerve, forms a tympanic plexus, through the tympanic branch of glossopharyngeal nerve forming tympanic plexus, and via lesser petrosal nerve traversing the parasympathetic fibers will relay in the otic ganglion. From here postganglionic fibers arises and via auriculotemporal nerve it is giving innervation to parotid gland. So, this is how the whole flow chart is there. I would also like to show you this this whole flow chart. So, once again see here, inferior salivatory nucleus is located at the inferior salivatory nucleus, as you can see here, from where the preganglionic parasympathetic fibers arises. From here glossopharyngeal nerve through tympanic branches forming tympanic plexus, and via lesser petrosal nerve again in otic ganglion the fibers relay, and via auriculotemporal nerve it supplies the parotid gland parasympathetic fibers. So, yes, so this is the reason, as we have seen here, the lesser petrosal nerve is involved, not the greater petrosal nerve. So, greater petrosal nerve is the wrong option. So, we will go with C as the wrong option. Got it, everyone? Now, let us move on to the next, that is question number 15. Okay, stave cells. Stave cells are seen in which of the following? Stave cells. Stave cells are seen in all of, seen in which of the following structure? Whether it is seen in liver, spleen, pancreas or gallbladder. Liver, spleen, pancreas or gallbladder. Stave cells are seen in liver, spleen, pancreas and gallbladder. Stave cells are seen in which of the following? Liver, spleen, pancreas and gallbladder. Mark the correct answer. Question number 15. So spleen, absolutely right. So goal to aims has given absolutely right. And I also want to give you the definition of stave cells. What do you mean by stave cells? Actually, this is the structure which is seen in the red pulp of, this is seen in the red pulp of the spleen. It is seen in the red pulp of the spleen. What is it? Actually, what happens, if you will see in, this is the schematic diagram to help you to understand stave cells in case of spleen. Actually, splenic sinusoid. So this is what? This is the splenic sinusoids which you are seeing, which is spindle shape. So this splenic sinusoids are spindle shaped. Splenic sinusoids are spindle shaped, as you can see in the diagram. It is spindle shaped. And what do you mean by sinusoids? The word sinusoids means it is a capillary which is having fenestration. It is having the capillaries which is having a gap in the endothelium, also gap in the basement membrane. So this sinusoid का मतलब होता है discontinuous endothelium of the capillaries plus the basement membrane. So both of this is discontinuous, so it is highly permeable. So this is the reason sinusoids become highly permeable, because there is discontinuous capillaries and also basement membrane. Now this splenic venous sinusoids is having a covering of, so you can see so many reticular fibers are surrounding it. So many supporting network of reticular fibers are surrounding it, and this whole appearance which you are seeing here, this whole appearance which you are seeing here is giving you the appearance of barrel shaped structure. What is the shape? The shape of this structure is, it is barrel shaped. As you can see in the diagram, it is barrel shaped, and this barrel shaped structure is seen in the red pulp of the spleen, and this is called as stave cells. This is called as stave cells. Yes, Nidhi, you are absolutely right. So B is perfectly correct answer. So B is perfectly correct answer. Yes, great. So yes, correct, absolutely correct, dear. Absolutely correct. Now, okay, we have done with this. Now, before ending the session, I would like to give you the information which all sessions we are coming up. So, my dear aspirants, I want to tell that firstly, I want to tell you about my own sessions which is coming up. Actually, we have covered up today 2 p.m. sessions and 4 p.m. anatomy quiz. Those who have left out, so those who have left out, which they can see the session once more. And now at 6 p.m. today's third session of anatomy quiz is there. All of you do join the anatomy quiz which I am going to take at 6 p.m. session. So this will be highly beneficial for you. So do join for anatomy quiz 6 p.m. targeting FMG examination. 6 p.m. session. Targeting anatomy, FMG anatomy MCQs. I also want you to tell about the free live sessions on the Unacademy platform. Free live sessions on the Unacademy platform. So for free live sessions, you can use unlock code. So if so, firstly you have to download the Unacademy app. So सबसे पहले आपको क्या करना है? You have to download the Unacademy app. Okay, you have to download the Unacademy app from the Play Store. And thereafter you have to find your goal as NEET PG. So find your goal as NEET PG, and thereafter you can use my code NAT10 to unlock the free sessions on the Unacademy platform. So I want you to give the information that Saturday evening and Sunday morning. Saturday evening and Sunday morning. So I just want to give you the information that Saturday evening and Sunday morning. Saturday evening, that is 6 p.m., 7 p.m., 8 p.m. and Sunday morning, there will be the sessions. Okay, this Saturday and Sunday morning there will be special free sessions. So I will take 5 free special sessions targeting cadaveric images and clinical anatomy MCQs. So cadaveric images sessions and clinical anatomy MCQs. All of you can join me for the cadaveric image and clinical anatomy MCQs. Clinical anatomy MCQs on Unacademy platform. On Unacademy platform, free session. So the link will be provided in the Let's Crack NEET PG Telegram group. Link will be provided in Let's Crack NEET PG Telegram group, and also on the Unacademy group, that is also in the Let's Crack NEET PG Telegram group and Unacademy group, where you can get the links for the free session. So you can be there and you can have the link of my session. So unlock code is NAT10. This will be provided. Okay. And thank you so much for being live. So very nice discussion, and all of you have very sincerely participated in the series. So another important point of the special free session is that you can get, yeah, very good, but very good VV associate. So for the first year students, it is also important that you should practice MCQ session, because it will be very useful for you to target, and MCQ sessions will help you to target your university exam along with the next exam. So जो भी फर्स्ट ईयर के स्टूडेंट्स होते हैं उनकी एनाटमी ज़्यादा अच्छी होती है, बिकॉज दे हैव स्टडीड इट फ्रेश. So you can come up with the MCQ sessions also on the platform of Unacademy. Use the unlock code NAT10. NAT10 is the unlock code for seeing the free session and also for taking the subscription. Get 10% discount by using the code NAT10. All the best. So again I will come up with the 6 PM session. So अगर आप sessions, when you see the sessions on the Unacademy app, free special sessions, you can also download the PDF notes. So that becomes a highly important for you. All the best. Keep studying. Thank you so much. Again, YouTube channel पे Let's Crack NEET PG. Subscribe, like and share. You can see my one more session, which is today at 6 PM and Thursday and on Saturday morning 10 AM. So you can be present. Yes. All the best, VV associate. All the best. Good performance. Let's meet at 6 PM. All the best. Thank you. Thank you, dear. Thank you.